We're going to look at some of the diseases of the immune system in Chapter 19. So we'll start with an overview and then get into the type 1 hypersensitivity reactions. There is a spectrum of immune disorders ranging from hypersensitivity reactions to immunodeficiencies. Here's a nice continuum showing you the range of immune disorders. In the middle, we have normal immune function, and that's where we want to be. But if our immune system overreacts and we get too much of an immune response, then we end up with hypersensitivity reactions. And those include things like allergies, autoimmune diseases, and transplant rejections. And then at the opposite end, if our immune system is not responding enough, then we end up with immunodeficiencies. And that's where the person will get all kinds of infections and cancers. So we're going to start off by looking at the hypersensitivity reactions with too much of an immune response. Hypersensitivity reactions are exaggerated immune responses the second time or later that you're exposed to an antigen. So it's really important to note that you're not going to get a hypersensitivity reaction the first time you're exposed to something. The problem with these hypersensitivity reactions is that they can damage the tissue. There's 4 different types of hypersensitivity reaction. These are really important to know, so make sure you start with these. Type 1 hypersensitivity reactions involve IgE antibodies, and they occur pretty much immediately after exposure to the antigen, so usually within a few minutes to maybe 30 minutes. Type 2 hypersensitivity reactions are called cytotoxic because cells end up getting killed, and these involve IgG and IgM antibodies. Type 3 hypersensitivity reactions involve immune complexes. So notice that these first 3 hypersensitivity reaction types all involve antibodies and humoral immunity. The type 4 hypersensitivity reactions are really different because they involve the cytotoxic T lymphocytes, or cell-mediated immunity. Their onset is delayed. It's usually going to take a day or 2 days to see the effects. And type 2 and type 3 hypersensitivity reaction, usually we see their effects within a couple hours. This table summarizes the 4 different types of hypersensitivity reactions. So make sure you know what causes each of them, so what's happening. And then we're going to talk about several examples of each of these as we go along. So the type 1 hypersensitivity reaction, this is also known as an allergy. So allergies can be localized, where maybe you just get hay fever or hives or something like that. Or we can end up with systemic anaphylactic reactions, and those are the ones that are life-threatening. So just some vocabulary words. An allergen is just the antigen that causes an allergic reaction, and an allergen could be a lot of different things. It could be grass pollen, maybe it's cat dander, maybe it's peanuts. It could be all kinds of things that you could be allergic to. So let's take a look at a picture of what happens with a type 1 hypersensitivity reaction. Allergens enter the body either through the mucous membrane or through the skin. Once they're inside of your body, they're going to be recognized by a specific B lymphocyte, which will then present the allergen to the helper T cell that recognizes the allergen. And then the helper T cell will activate the B lymphocyte, give it the go-ahead signal to start dividing. The B lymphocyte will produce some plasma cells, which will then start producing IgE antibodies. Allergies are just a genetic predisposition to your B lymphocytes producing too many IgE antibodies. So remember that it takes about 10 days before you start producing antibodies the first time you're exposed to something. So by the time you get the IgE antibodies produced, the allergen might already be gone. But these IgE antibodies, because you've produced too many of them, they will get stuck into the membranes of the mast cells. And then this is just like a little ticking time bomb, and it will be waiting there until you're exposed to the allergen a second time. When you're exposed to the allergen the second time, the allergen will then bind to the IgE antibodies on the mast cells. That will trigger the mast cells to release the histamine, and then that will cause all the signs of the allergies. And then this link here is a really nice animation that goes through how type 1 hypersensitivity reactions occur. And this is just a picture showing you the mast cell or the basophil. And here we've got the allergen binding to the IgE antibodies stuck in the membrane. And that'll trigger the mast cell or basophil to release the histamine, which will cause the signs of the allergies. So this is just a cool electron microscope view that shows the little packets, little granules of histamine that get released from these mast cells. And histamine is going to cause all the signs of the allergies. So there's a couple things that histamine does. Remember before that we talked about how it vasodilates and increases the capillary permeability. So we talked about that in inflammation. It does have some other effects as well. It can also cause smooth muscle to contract, for example in the airways, which will make it difficult to breathe. Can increase mucus secretion, so thinking about like a runny nose, and also can make you itchy as well. And depending on how much histamine is released, if it's just a localized area, we'll just get the allergies. And then if we have widespread release of histamine, that'll cause an anaphylactic reaction. When there's a widespread massive release of histamine throughout the body, this causes systemic anaphylaxis. So anaphylaxis means against protection. Ana means against and phylaxis means protection. So this is not protecting you, but it can actually kill you very quickly within a matter of minutes. So when a large amount of histamine is released from these mast cells, it will affect the airways by constricting the smooth muscle around the bronchioles. So that'll make it difficult to breathe. The person will be wheezing and gasping for breath. And also the histamine can cause the throat to swell, which also will further cause problems with breathing. The histamine also causes vasodilation. So if we have lots of dilation all over the body throughout the blood vessels, that will drop the blood pressure. And if the blood pressure decreases, that will decrease the blood flow to the organs. And now the organs are not getting enough blood and oxygen, and they start to die. So this causes what's known as circulatory shock or anaphylactic shock. And shock is just a condition when the organs are not getting enough blood flow and oxygen. So in order to treat this, usually the person will be carrying around an EpiPen with them. And when you inject the EpiPen containing epinephrine into their thigh, the epinephrine will counteract the effects of the histamine. So epinephrine will dilate the airways, make it easier to breathe, and then it will also constrict the blood vessels, which will increase the blood pressure and increase the blood flow to the organs. If the histamine is released from the mast cells just in a localized area of the body, then we can get different symptoms depending on where it's being released. So if the allergen is getting into the body through the upper respiratory tract, like through the nose and the eyes, that'll cause the symptoms of hay fever. So that's where you get the sneezing, runny nose, maybe you get the red, puffy eyes, watery, itchy, that's all hay fever. And if the allergen is getting deeper down in the lungs and entering through the lower respiratory tract, and that's where you're releasing the histamine, then that will cause asthma. We can see hives on the skin if the allergen is entering through the GI tract, like a food allergy, or if it's something like an insect bite on the skin. So here's what happens during an asthma attack. So the normal airway is on the left, and here's the airway in a person having an asthma attack. So the release of histamine will cause several things in the airways. So it'll cause the airways to swell, increase mucus production, and also will cause the smooth muscle around the bronchioles to constrict. So all of this will really narrow the airways, and that'll make it difficult for the person to breathe. So you'll see them wheezing and really struggling to breathe. Allergies are diagnosed by doing skin tests where they will inject a small amount of different allergens into your skin, and then they will take a look and see if you get any hives or redness, itching in those areas, and then they know that you're allergic to that particular allergen. To treat allergies, you could do allergy shots or desensitization, and we'll take a look at how that works. And then there's also a lot of allergy medications you can take. So things like antihistamines, like Benadryl, they work because they block the histamine from binding to receptors in the body and block the action of histamine. Also taking medications to block the immune system from working as well. So things like steroids, and there's some other things you can take. If you have asthma, you might be on bronchodilators. And then also if you have hay fever, you might be just treating some of the symptoms, like maybe taking a decongestant. This is a picture of the skin testing they do to figure out what you're allergic to. They'll just inject small amounts of different allergens under your skin. And if you're allergic, you're going to get a reaction fairly quickly, and then they can figure out what it is that is bothering you. Here's how the allergy shots or desensitization works. So maybe this person is allergic to cats. So they would just inject a small amount of cat allergen. And the idea is that you want your B lymphocytes to start producing some IgG antibodies. You've already produced these IgE antibodies that are already stuck into the membrane of the mast cells. But the idea behind producing these IgG antibodies is that they will bind to the allergen and prevent it from binding to the IgE antibodies on the mast cells. And that way you don't release the histamine and you don't cause the symptoms of the allergies.